Today we will discuss very important topic in anatomy, Brown-Sequard syndrome. Before knowing this syndrome, you should know the ascending and descending tract. Ascending tracts includes dorsal tract, which fasciculus gracilis, fasciculus cuneatus. Fasciculus gracilis carries conscious proprioception, fine touch, vibration, stereognosis, some pressure from the lower limbs, whereas fasciculus cuneatus carries conscious proprioception, fine touch, vibration, stereognosis, some pressure from the upper limb. These tracts ascend up and decussate at the level of lower part of the medulla oblongata. Now we will discuss about the spinocerebellar tract. Dorsal and ventral spinocerebellar tract. These carries unconscious proprioception ipsilaterally to the cerebellum. Unconscious proprioception. Now we will discuss the spinothalamic tract. Spinothalamic, from the spinal cord to the thalamus. Anterior and lateral spinothalamic tract. These carries pain, temperature, crude, touch, pressure from the spinal cord to the thalamus. These tracts decussate at the level of nucleus to the opposite side, which anterior and lateral spinothalamic tract decussate opposite side at the level of the nucleus itself. Okay, now we will discuss corticospinal tract. Anterior corticospinal tract and lateral corticospinal tract. Anterior corticospinal tract carries motor impulses to the axial muscles, whereas lateral corticospinal tract carries motor impulses to the limbs, upper and lower limbs. These are the motor from the cortex to the spinal cord. Now we will discuss the Brown-Sequard syndrome. Is the hemisection of the spinal cord seen in Brown-Sequard syndrome. Hemisection means loss of half of the spinal cord, lesion. Okay, now what will happen in Brown-Sequard syndrome we will see. Now this hemisection of the spinal cord means the lesion of the spinal cord, which is half of the spinal cord. Now there is a loss of dorsal columns, means loss of conscious proprioception, fine touch, vibration, stereognosis, some pressure at the level of lesion and below the level of lesion, because these tracts ascend up and decussate at the level of lower part of the medulla. So there will be a ipsilateral loss of fine touch, vibration, stereognosis, conscious proprioception and some pressure, ipsilateral loss. Now we will see spinocerebellar tracts. These are also ipsilateral. So ipsilateral loss of unconscious proprioception at the level of lesion, below the level of lesion we will see unconscious proprioception loss. Now spinothalamic tract, anterior spinothalamic tract, lateral spinothalamic tract. These tracts decussate opposite side. So there will be a loss of ipsilateral loss of pain, temperature, crude touch, pressure at the level of lesion. Contralateral loss of pain, temperature, crude touch, pressure below the level of lesion. Why? Because these tracts ascend up at the level of nucleus and ascend up contralaterally. So there will be a ipsilateral loss of pain, temperature, crude touch, pressure at the level of lesion, and contralateral loss of pain, temperature, crude touch, pressure below the level of lesion contralaterally. Okay, did you understand? Now we will discuss spinothalamic tract, lateral spinothalamic tract, ventrospinal thalamic tract completed. Now corticospinal tract. At the level of lesion, lower motor neurons are involved. So ipsilateral loss of paralysis of ipsilateral, whereas below the level of lesion there will be a spastic paralysis of the lower limb muscles and upper limb muscles in case of corticospinal tract lesions. As they descend up, they decussate at the level of lower part of medulla oblongata, so there will be only ipsilateral paralysis at the level of lesion. Below the level of lesion, there will be a spastic paralysis of the muscles will takes place. Please like and subscribe.